everyone, my name is April. I'm a master's in public health student, and this summer I had the privilege of interning at the New Hampshire Department of Health and Human Services, where my project focused on viral hepatitis data analysis and evaluation. So, what does that actually mean? Viral hepatitis is a series of conditions that can affect the liver. These conditions are infectious in nature, so they're different from the liver disease you may be familiar with that results from excess alcohol consumption. Well, DHHS has been conducting surveillance on viral hepatitis for many years. There's been no formal evaluation of the system, so we really don't know how well it's performing. To give a little context on what public health surveillance is, it's helpful to think about what happens when you go to the doctor and the public health work that goes on behind the scenes. So, we're probably all familiar with feeling sick, going to the doctor, and getting treatment. But you may not be so aware that healthcare providers are required to report cases of infectious disease to the state. And there are several administrative processes that make that possible. Many gaps can occur throughout this process. Just for instance, not everyone who has hepatitis will experience symptoms, and not everyone has access to a doctor. They may be uninsured or not be able to access that due to transportation barriers and so on. So that's why it's so important that I conducted this gap analysis to really take stock of these rooms for error in the system. So to do that, I began by reviewing internal protocol documents, as well as some guidance and case definitions from the CDC. Then I conducted semi-structured interviews with 10 different members of the team. And I also analyzed the data that we collect, comparing the variables DHHS collects with those recommended by the CDC, and also analyzing variable completion for the past 10 years of data collection. I synthesized my findings into two key deliverables. First, the gap analysis with a comprehensive table showing those gaps across different categories, and then a data improvement plan with some concrete recommendations. The biggest gap I identified was the state policy that really focuses on a rather clunky process for reporting cases. And this could certainly be improved by having a more automated, streamlined approach where lab results are directly sent to DHHS. I also found gaps at different levels in this surveillance system, such as the database and its infrastructure, healthcare providers, the linkage to care team who's responsible for investigating cases, and in the data collection process itself. Overall, I tried to make my recommendations really actionable and focused on what we can achieve in the near term. So those include things like creating a standardized protocol for case notes, gathering some qualitative data through patient interviews, and perhaps even leveraging healthcare providers to do that, since they really have built trust with their patients. And also expanding the education that DHHS provides to doctors so that they really understand the how and when and why of reporting viral hepatitis cases. And finally, adjusting some of the variables DHHS collects, so removing the redundant ones and adding ones that are missing. And policy change and advocacy is also super important, but that's something that will occur a little more in the farther out future. So I really kept my recommendations focused on the next few months to year. And this work will help DHHS finish up a grant that they received for viral hepatitis surveillance. And ultimately, this will help us all keep better track of cases throughout the state to understand how to deploy resources and address any outbreaks that may occur. Thank you so much for tuning into my presentation, and I want to give a special shout out of gratitude to my mentor, Carrie, as well as advisors, Alexis and Jake, and everyone at DHHS who welcomed me with such open arms. Thank you very much.